female reproductive system is one of the most intricate and fascinating systems in nature, capable of growing a new life. Located entirely inside the pelvic basin, it consists of four main parts: the ovaries, fallopian tubes, uterus, and vagina. It all begins with the ovaries. These two almond-shaped organs are the keepers of the eggs. Unlike men who produce sperm daily, a woman is born with all the eggs she will ever have, about 1 to 2 million. Every month, hormones signal one of these eggs to mature inside a fluid-filled sac called a follicle. At the middle of the cycle, ovulation occurs. The ovary releases the mature egg. The egg is caught by the finger-like ends of the fallopian tube, which guide it inside. Inside the tube, tiny hairs called cilia gently push the egg toward the uterus. This journey takes a few days. This is the critical window. If sperm is present, fertilization usually happens here, inside the fallopian tube. The tube leads to the uterus, or womb. This hollow, muscular organ is where a baby grows.
Each month, the inner lining of the uterus, called the endometrium, thickens with blood and nutrients. It is preparing a soft bed to receive and nourish a fertilized egg. But if the egg is not fertilized, it simply dissolves. Since the lining is no longer needed, the body sheds it. This shedding is what we call menstruation, or a period. The blood exits through the cervix, the narrow neck at the bottom of the uterus. It then travels down the vagina, an elastic muscular canal that connects the womb to the outside world. This entire cycle typically lasts about 28 days, though it varies from woman to woman. Two main hormones control this dance: estrogen and progesterone. Estrogen is responsible for female characteristics, like breast development and widening of the hips during puberty. Now, what happens if the egg is fertilized? A miracle begins. The fertilized egg, now called a zygote, starts dividing rapidly as it travels to the uterus. It burrows deep into the nutrient-rich lining. This is called implantation. Pregnancy has officially begun. A completely new organ, the placenta, forms to feed the baby and filter waste. The uterus is amazing. It can expand from the size of a pear to the size of a watermelon to hold a baby. To protect the baby, the cervix creates a mucus plug, sealing the womb from outside bacteria. During birth, the cervix dilates or opens up to 10 centimeters, and the vagina becomes the birth canal. Eventually, as a woman ages, the ovaries slow down. This phase is called menopause. When estrogen levels drop during menopause, it can affect bone density, making bones weaker. Like any system, things can go wrong. Let's look at some common issues. PCOS, or polycystic ovary syndrome, causes hormonal imbalance and small cysts on the ovaries. Fibroids are non-cancerous muscular growths in the uterus that can cause pain or heavy bleeding. Endometriosis happens when the uterus lining grows outside the womb, causing severe pain. The human papillomavirus, HPV, is a common virus that can affect the cervix. That's why regular pap smears are vital to detect any changes early. The vagina is self-cleaning and maintains an acidic pH to kill bad bacteria. Using harsh soaps inside can disrupt this balance and cause infections. Because the urethra is short and close by, women are also more prone to urinary tract infections, UTIs. There are many ways to manage fertility, from hormonal pills to IUDs placed in the uterus. For example, a copper IUD changes the environment so sperm cannot survive the swim. Permanent birth control, or tubal ligation, involves blocking the fallopian tubes. Though not in the pelvis, breasts are part of the reproductive system and need regular checks. A balanced diet and hydration are key to keeping hormones and cycles regular. Exercise improves blood flow to the reproductive organs and reduces menstrual pain. The female reproductive system is resilient, complex, and the origin of human life. Its ability to heal and adapt, from menstruation to childbirth, is nothing short of miraculous. To recap, ovaries release eggs, tubes transport them, the uterus hosts the baby or sheds the lining. Listening to your body and tracking your cycle can tell you a lot about your overall health. Did you know a woman's heart beats faster during ovulation? Share your thoughts below. If you learned something new, please like this video and share it to spread awareness. Subscribe to our channel for more amazing journeys inside the human body. Take care.
It starts with the scrotum, a loose pouch of skin that hangs behind the penis. Millions of sperm are created here every day. The prostate adds a milky fluid that helps protect and nourish the sperm. At the peak of excitement, muscles contract rhythmically to force the semen out. Erectile dysfunction happens when there is not enough blood flow to maintain an erection. Men should also perform regular self-exams to check for any lumps or changes in the testes. The male reproductive system is a complex network of organs designed for one primary purpose: the creation of life. Unlike the female system, much of the male reproductive anatomy is located outside the body. It starts with the scrotum, a loose pouch of skin that hangs behind the penis. Inside this pouch are two oval-shaped organs called the testes, or testicles. They are kept outside the body to maintain a temperature slightly lower than the rest of the body, which is essential for healthy sperm production.
Think of the testes as the factory. They have two main jobs: making testosterone and producing sperm.
Inside each testicle are tightly coiled masses of tubes called seminiferous tubules. This is where sperm production, or spermatogenesis, takes place. Millions of sperm are created here every day. A sperm cell is microscopic. It has a head carrying genetic material, a midpiece for energy, and a tail for movement. Once produced, sperm move into the epididymis, a long coiled tube resting on the back of each testicle. Here, sperm are stored and matured. This is where they learn how to swim.
When sexual arousal occurs, sperm are forced into the vas deferens, a long muscular tube.
The vas deferens transports mature sperm to the urethra in preparation for ejaculation.
Along the way, fluids are added. First, from the seminal vesicles. These glands produce a sugar-rich fluid that provides sperm with the energy to move. Next is the prostate gland, a walnut-sized organ located just below the bladder. The prostate adds a milky fluid that helps protect and nourish the sperm. Finally, the bulbourethral glands add a clear, slippery fluid to lubricate the urethra. This mixture of sperm and these fluids is what we call semen. This semen travels into the urethra, the tube that carries both urine and semen out of the body. During ejaculation, a muscle closes off the bladder to ensure urine doesn't mix with the semen.
The penis is the external organ used for intercourse. It consists of the shaft and the head, or glans. At birth, the glans is covered by loose skin called the foreskin. This is often removed in a procedure called circumcision.
Inside the penis are three cylinder-shaped chambers made of sponge-like tissue. When a man becomes sexually aroused, blood rushes into these tissue chambers. The tissue expands and hardens, causing an erection. This allows the penis to enter the female reproductive tract. At the peak of excitement, muscles contract rhythmically to force the semen out. This is ejaculation. A single teaspoon of semen can contain between 200 to 500 million sperm cells. This entire system is driven by the primary male sex hormone, testosterone. During puberty, testosterone causes physical changes like muscle growth, deep voice, and facial hair. It also regulates sex drive or libido and maintains muscle mass and bone density. Sometimes, issues like low sperm count or poor motility can lead to infertility.
Excessive heat, like from hot baths or tight clothing, can temporarily reduce sperm production.
Swollen veins in the scrotum, called varicocele, are a common cause of male infertility.
As men age, the prostate gland often enlarges, which can pinch the urethra and cause urination problems.
Prostate cancer is one of the most common cancers in men, making regular checkups vital. Erectile dysfunction happens when there is not enough blood flow to maintain an erection. For permanent contraception, a vasectomy is performed by cutting the vas deferens tubes. A diet rich in zinc, regular exercise, and avoiding smoking helps maintain a healthy reproductive system. Unlike women, men do not stop producing sperm, but testosterone levels do drop slowly with age.
Ultimately, the goal of this entire system is to deliver genetic material to the female egg.
When fertilization happens, a new, unique human life begins to form. Maintaining good hygiene prevents infections and keeps the system functioning well. Men should also perform regular self-exams to check for any lumps or changes in the testes. It is a robust, yet delicate system that requires care and attention.
From the production factory in the testes to the delivery system of the penis, nature's engineering is amazing.
Remember, your sexual health is deeply connected to your mental and physical well-being.
Did you know the life cycle of a sperm cell is about 74 days? Comment below if you learned something new.
If you found this educational video helpful, please like and share it with others. Subscribe to our channel for more detailed medical animations. Thanks for watching. Every time you light a cigarette, you are not just burning tobacco. You are igniting a chemical factory.
This is why smokers often feel short of breath. Their blood is carrying poison. This condition is called loss. If pregnant, the toxins pass through the umbilical cord. But here is the good news. Make the choice today. Put down the cigarette and pick up your life.
Every time you light a cigarette, you are not just burning tobacco. You are igniting a chemical factory.
With a single puff, over 7,000 chemicals rush into your body. Let's follow this toxic cloud inside.
First, the smoke travels down your windpipe or trachea, hitting the delicate lining of your airways. Normally, tiny hair-like structures called cilia act as sweepers, cleaning out dust and mucus.
But cigarette smoke paralyzes these cilia instantly. They stop moving, and dirt begins to be trapped.
This allows tar, a sticky brown substance, to coat your lungs, just like soot in a chimney. Deep inside, the smoke reaches the alveoli, the tiny air sacs where oxygen enters your blood. Here, a silent killer takes over. Cigarette smoke is full of carbon monoxide.
Carbon monoxide binds to your red blood cells 200 times faster than oxygen, effectively suffocating your organs.
This is why smokers often feel short of breath. Their blood is carrying poison instead of fuel.
Meanwhile, a chemical called nicotine reaches your brain in just 10 seconds.
It triggers a flood of dopamine, the feel-good chemical. You feel relaxed and alert instantly.
But this is a trap. As soon as the nicotine fades, your brain craves more, creating a cycle of addiction.
Nicotine also acts as a stimulant. It forces your heart to beat faster and work harder. It constricts or narrows your blood vessels,
instantly raising your blood pressure.
Smoking makes your blood sticky, increasing the risk of dangerous clots forming in your arteries.
Over time, it damages the lining of your arteries, causing fat and cholesterol to build up faster.
This is why smokers are twice as likely to suffer a heart attack or stroke. Back in the lungs, the damage gets worse. The delicate air sacs lose their stretchiness and rupture. But the scariest damage happens at the microscopic level. The chemicals in smoke damage your DNA. This condition is called emphysema or COPD. The damage is irreversible. The lung tissue never grows back. When the DNA that controls cell growth is broken, a cell can turn into a cancer cell. This cell divides uncontrollably, forming a tumor. Lung cancer is the #1 cancer killer.
And it's not just lung cancer. Smoking causes cancer in the throat, bladder, stomach, and pancreas.
It also weakens the valve at the top of your stomach, causing acid reflux and heartburn. Externally, smoking restricts blood flows to your skin, breaking down collagen and causing premature wrinkles. It stains your teeth yellow and causes gum disease, leading to tooth loss. Your immune system weakens. Smokers catch colds and flu more easily and take longer to recover. It even affects your bones, making them brittle and increasing the risk of fractures.
For both men and women, smoking drastically reduces fertility and reproductive health.
If pregnant, the toxins pass through the umbilical cord, depriving the baby of oxygen.
Aside from health, think about the financial cost. You are literally burning your hard-earned money.
Even if you don't smoke, breathing in secondhand smoke causes the same damage to your loved ones.
But here is the good news. The human body is incredibly resilient. The moment you quit, healing begins.
Just 20 minutes after your last cigarette, your heart rate and blood pressure drop to normal.
Within 12 hours, the carbon monoxide levels in your blood return to normal. Your organs can breathe again.
After 2 weeks to 3 months, your circulation improves and your lung function increases. Within 9 months, the cilia in your lungs grow back, reducing coughing and shortness of breath. After 1 year, your risk of coronary heart disease is half that of a smoker's. After 5 years, your arteries widen. After 10 years, the risk of lung cancer falls to about half that of a smoker.
And after 15 years, your risk of heart disease is the same as someone who has never smoked.
Quitting is hard. The withdrawal symptoms are tough, but they are temporary.
Don't be afraid to use nicotine patches, gum, or ask for professional help. Food will taste better, smells will be sharper, and you will have more energy.
Quitting smoking literally adds years to your life. From tar-filled lungs to clogged arteries, the damage is real. But so is the healing.
Make the choice today. Put down the cigarette and pick up your life. If this video opened your eyes, please like and share it to help a friend quit. Subscribe to our channel for more deep dives inside the human body. Breathe free.
The stomach. It is
one of the most vital organs in the body, often called the body's mixer machine.
It is a J-shaped muscular pouch located in the upper abdomen, just under the ribs on the left side.
When empty, it is small, but like a balloon, it can expand to hold between 1 to 4 liters of food. When we swallow, food travels down the esophagus, or food pipe. At the entrance of the stomach lies a valve called the lower esophageal sphincter. Once food enters, this valve snaps shut tightly to prevent stomach acid from splashing back up into the throat. The interior wall of the stomach isn't smooth. It has ridges and deep folds called rugae. These folds allow the stomach to stretch and expand when you eat a large meal. Unlike other organs, the stomach has 3 distinct layers of powerful muscles. These muscles physically crush the food, churning and twisting it like a cement mixer. Alongside mechanical work, the stomach is also a chemical factory.
Its lining secretes a powerful digestive fluid, hydrochloric acid.
This acid is so strong that it kills bacteria and viruses that enter with your food. With a pH of 1.5 to 2, this acid is strong enough to dissolve metal.
It also releases an enzyme called pepsin, which specifically breaks down proteins like meat and eggs.
So why doesn't the stomach digest itself? Because it is coated in a thick, protective layer of mucus.
If this mucus layer is damaged, the acid burns the stomach wall, creating a painful sore called an ulcer.
After 3 to 4 hours of processing, the food turns into a thick, creamy liquid called chyme.
Then, the bottom valve, known as the pyloric sphincter, opens slightly.
It releases the liquid food bit by bit into the small intestine, ensuring proper nutrient absorption.
Many think digestion finishes here. Actually, the stomach mostly breaks food down.
When empty, the stomach releases a hormone called ghrelin, signaling your brain that you are hungry.
When full, it signals the brain to stop. However, this signal takes about 20 minutes to reach the brain.
That's why eating too fast often leads to overeating, putting immense pressure on the stomach.
If you lie down right after eating, acid can leak back up, causing heartburn or GERD.
A major cause of ulcers is the H. pylori bacteria, which burrows into the lining to hide from the acid. If toxins enter the body, the stomach detects them and violently reverses the flow to vomit them out. Excessive alcohol or painkillers can strip away the protective lining, causing gastritis. Smoking weakens the top valve of the stomach, significantly increasing acid reflux.
Spicy foods don't cause ulcers, but they can irritate an already sensitive stomach lining.
Carbohydrates, like bread or rice, take only 1 to 2 hours to digest. Proteins, like meat, take longer, about 3 to 4 hours.
Fats stay in the stomach the longest, taking up to 6 hours to break down.
Drinking enough water aids the digestion process and helps prevent constipation.
Chewing your food well cuts the stomach's workload in half.
Excessive anxieties can slow down digestion, causing bloating, indigestion.
Probiotics, found in yogurt, introduce good bacteria that help keep your stomach healthy.
Occasional fasting allows the stomach to initiate a cleaning wave to sweep out debris. In weight loss surgeries like gastric bypass, the stomach is surgically made smaller.
That rumbling sound you hear? It's just gas and fluid moving through your hollow intestines.
Sleeping on your left side helps keep the stomach acid down due to the stomach shape. Fiber keeps you full longer and aids in smooth digestion. Eating heavy meals late at night forces the stomach to work when it should be resting.
The stomach has so many neurons that scientists call it our second brain.
That butterflies feeling when you are nervous is actually blood rushing away from the stomach to the muscles. Eating smaller, frequent meals is much better for your stomach than one huge meal. To recap, the stomach stores food, churns it, kills bacteria, and prepares it for absorption. A healthy stomach means a healthy life. So treat it well with good food and habits.
If you enjoyed this video, hit like and share it to help others understand their digestion. Subscribe to our channel for more amazing insights into the human body. Thanks for watching.